Hey guys, Dr. Cosby here. As we're finishing up Module 1, I thought what a better way to kind of bring everything together than to take a clinical case study and create a PICO with you guys. So walk you through the steps of forming PICO. I think it's very important to plan your research before jumping in and searching for articles. And the reason you don't just start searching for articles is because the PICO really truly does kind of help you create search terms that would yield more specific research articles and probably create a more fruitful group of research articles that can be used to help answer your clinical questions. So let us start by looking at hopefully a clinical case study that all of us can kind of relate to, no matter which profession in the allied healthcare area we are in. So let's say you have a patient or a family member with carpal tunnel syndrome and they want to avoid surgery. So they come to you and they ask you if the non-surgical treatments that you know of are effective at reducing either pain, improving function when compared to the surgical procedure. And so you, the clinician, you've heard about various conservative treatments, but you're not sure if their effectiveness has been established by scientific evidence, right? So we really need to find out if there are non-surgical treatments that exist, and if they exist, how effective are they? And we're going to use our literature search and the research to drive our clinical decision making at the end of this case study. So the first step in forming the PICO is to take this clinical scenario and then to identify the pieces of information that will help us form the correct clinical question, or the correct PICO clinical question that we're going to use to then research and find articles that might help support our decision as we're interacting with this patient. So the PICO acronym is an acronym that describes the elements of what is called a well-formed clinical question. And as we talked about in length in Module 1, PICO stands for patient, intervention, comparison, and outcome. And so with the P, that could be either the patient, the population, or it could be a problem that you are trying to solve. For the intervention, what we're saying is that intervention is what you want to do with the patient. So in this case, the intervention probably is going to be the non-surgical or conservative approach to treating carpal tunnel syndrome, right? The comparison on the opposite end of the spectrum is going to be what intervention you want to compare to. And so in this case, it's probably going to be surgery. And then the outcome, which I have yet to say, is what you are trying to accomplish or to measure or to improve, right? And so in this patient, it could be several different outcomes. It could be pain, it could be range of motion, it could be just improvements in activities of daily living. So the outcome is truly what you want to accomplish or measure or reduce over time. So let's review our clinical case study one more time. This is a patient with carpal tunnel syndrome. They want to avoid surgery, and they're asking you if there is non-surgical treatments that are effective at improving outcomes in patients with carpal tunnel. So what we are going to do now is we're going to use the PICO approach to identify the appropriate elements in our clinical case scenario, and then hopefully we're going to use those elements to form our clinical question. So looking at our clinical case scenario, let's identify the PICO components. So the first component to the PICO is P. So that's going to either be the patient or the problem. In this specific case scenario, we're dealing with a problem, and that problem is carpal tunnel syndrome, right? And so the intervention, as I alluded to earlier, is going to either be non-surgical treatments that you can find or conservative treatments that you can find as well. And then our C, or our comparison, is going to be surgery, right? So we've got the problem, which is carpal tunnel syndrome. We have the intervention, which is going to be the conservative treatments that we find through our literature search. Then we have our comparison, which is going to be surgery outcomes, and then the outcome, let's say, is going to be reduced pain in this specific patient who came into your clinic. And so we've identified the PICO components, and so now it becomes important to use those PICO components to write a good clinical question, or to write a question that's formatted using PICO. So using the PICO components, I kind of formed my own PICO question, and I said, in adult patients, okay, so that could be the P, with carpal tunnel syndrome, or this could be the P, which is the problem, are conservative or non-surgical treatments effective at reducing pain, right? So that could be one PICO question that arises from this clinical case study. There are other clinical PICO questions that could arise from this case scenario as well, but this is just one example and one way to form a clinical case or a clinical question using the PICO format based on a case study scenario. Within the module, you will be asked to create your own PICO question based on clinical experience or exposure to either a patient population or a problem that you would like to solve. I'm hoping that by going through this process, it might also drive either your master's thesis or your capstone project as you move through this master's program. Thank you for listening to this online lecture. I will be facilitating this course, and as we move into the next module. From here, our next module, if you could guess, would be, now that we have the PICO question formed, how do we search the literature? How do we go into the database and yield fruitful results that can be used to hopefully kind of create our lit review in our master's thesis?